Ankle fractures are common injuries in sports and many other situations and traumatic events. In this video, I explain what the different types of ankle fractures are, when they need surgery, and what their recovery entails. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, ankle fractures are something that are injuries that are near and dear to my heart. I suffered one when I was in college, so I am well aware of how difficult they are. There's a variety of different ankle injuries and ankle fractures that we're going to talk about. So what you first of all need to understand when you're looking at the ankle is the different parts that are commonly affected. The bone on the outside of the leg is the fibula, and the end of it's what's called the lateral malleolus. Breaking that is probably the most common, where you just break that one bone. You could also have the end of the tibia or the shin bone, the prominence on the side of the medial side of your ankle, closest to the midline of your body. That bony prominence is called the medial malleolus. So medial malleolus, lateral malleolus. So you can break this one by itself. That's probably most common. You can break the medial malleolus by itself, albeit that's not all that common, or you can break them both. If you break both the lateral and medial malleolus, very often you end up needing surgery. Some of the fractures of just the medial malleolus or just the lateral malleolus, especially if they're lined up well, can do fairly well without surgery, maybe a cast or a walking boot to try to get that to heal, 6 weeks, 8 weeks, something like that to get it to heal. Very often, especially of the lateral malleolus, though, if there's separation of the bones, or it's broken into multiple parts, very often that is something that needs to be fixed surgically. Usually that's a plate and screws. Let's see if you can see that, where the plate's here and then the screws hold it in place. Sometimes with a screw or a device that goes into the tibia to basically pull the two bones together, what's called a syndesmosis repair or syndesmosis fixation for basically a syndesmosis injury. People know that also with high ankle sprains sometimes, but this is sort of a different component of that. If you need surgery, that surgery is generally fairly straightforward. It's basically waiting to get that bone to heal, get that fracture to heal. You get follow-up x-rays at each follow-up appointment, see more and more bone. The surgeon gradually lets you put more and more weight on it until the boot can come off or the cast can come off. Then again, start weight bearing, you start ankle range of motion, then a lot of work getting your strength back and working with a physical therapist to get back into your level of activity. So it can be a big injury in terms of recovery, even if it's a short outpatient surgery, or maybe it doesn't even need surgery. But again, it's fairly straightforward in terms of how they're treated. It's one that you would get x-rays, see an orthopedic surgeon to find out sort of what would work best for your particular injury and the nature of the fracture. And then you basically go with that type of treatment. So I'd love to hear your experience with your ankle injury, if it's an ankle fracture or not. Leave those in the comments below. Just know I can't offer you specific medical advice there, but I do try to answer the topics in those questions in future videos. Make sure to subscribe to my channel so you're notified when I release a new video. Click the bell to be notified, or when I start a new live stream like my Ask Dr. Geier live shows. If you have ankle, knee, hip, shoulder, or some other joint pain and you want to get significantly better in the next 30 days without cortisone shots or surgery, you can learn more about working with me in the description below. Thanks so much for watching, and I look forward to helping you feel, look, and perform better than ever.